Hello, it's Dr. Rhonda Johnson. Today is Monday, January 24th, 2022. And today I'm going to answer the question, do you need to have symptoms to use the rapid antigen COVID test? Well, first let's review what symptoms are. Symptoms are the body's way of letting us know that not everything is running smoothly. Yet some conditions show no symptoms at all. So, for example, you can have high blood pressure for years without having a single symptom. And there are some cancers which have no symptoms in the early stages. And then there's COVID, which can be asymptomatic, yet people can pass it on to others, and it can have deadly consequences. So let's move on over to the rapid antigen COVID tests, because many people are going to start receiving their 4 free rapid COVID tests in the mail soon. And some folks may wonder, when should they use them? So questions that people may have, should they be used as a screening test, to test asymptomatic people to see if they have COVID? For example, test before you visit grandma. Or should they be used for someone who has been a close contact or exposed to someone with known COVID? Or should they be used for someone who has COVID symptoms to confirm that it is COVID? Or should they be used for someone who has tested positive to see if they're still contagious? Well, the answer is that any of these scenarios are okay to use a rapid test. 4 tests from the United States government is not going to last too long, and every household will have to decide when and for what reason they're going to use their tests. But first, I want to also do a few quick reminders. Each rapid test will have an expiration date on it. Folks, you want to use it before it expires. Also, you got to keep those tests at room temperature. And please do not swab multiple family members with the same test swab, trying to stretch them out. Use 1 test per person. And don't swab the snot and the stuff outside the nose. Swab the inside of the wall of the nose for the best sample, because that's where the virus lives, inside the cells, okay? And you don't have to go far up the nose. You just want to touch the walls on the inside of the nose. Now, the rapid test only cares about how much virus is in the sample. It doesn't care about your symptoms, folks. The test is a chemical reaction. It tests the presence of the viral proteins. You can be infectious and not have a symptom. Symptoms may just help you decide when to test. So remember, the symptoms do not dictate if your rapid antigen test will be positive. You can have no symptoms and still test positive if the virus is present in your nose. That's my message. Be safe. Take care.